Hi, it's Patrick from Intensive Care at Home, where we help long-term ventilated adults and children with tracheostomy and their families to improve their quality of life, and we also help hospitals saving money and resources whilst providing quality care. Thank you for tuning into this week's blog, where I want to talk about how we help hospitals and intensive care units in particular freeing up their beds and staff. In last week's blog, I was talking about what an extension of intensive care looks like in the real world. If you haven't read the blog or if you haven't seen the video, just check out our blog or video section on our website. In this week's blog, I want to highlight and focus on how intensive care at home can help hospitals and intensive care units in particular to free up beds and staff, which are both valuable and expensive resources for any intensive care unit. By taking a long-term ventilated adult or child with tracheostomy out of intensive care into their own home, your organization wins on both ends. You would be having an empty bed that can be allocated and can be used for a more acutely unwell patient, and you would also be having staff available to accommodate a new and acutely unwell patient. Your organization would probably also save to book an agency staff member or book overtime or book a casual staff member to accommodate that new admission. And if you think about your staff satisfaction, your nursing and your medical staff would most likely also prefer to look after a new admission rather than after the day 60 trachea on a ventilator that isn't going anywhere soon. You can leave that to the specialists, such as intensive care at home, and you can worry about what you do best, which is acute intensive care. What intensive care at home can also do is to accommodate short-term and temporary respite for your long-term ventilated adults and children with tracheostomy by taking them home for up to 2 weeks or for however long you deem to be an appropriate time frame before returning the patient back to hospital. Chances are that if your patient is long-term ventilated and a difficult and slow respiratory wean, that by taking the patient out of intensive care into their own home, that they will blossom by being at home, and you have an empty bed, staff, and it will cost less than an ICU bed. I was giving a talk a couple of weeks ago here in Melbourne at the ACPEL conference, and a couple of intensivists asked me about doing short-term and temporary respite for some of their long-term ventilated patients, as they felt that this would speed up their recovery process, as they also thought that the difficulty in weaning somebody off the ventilator is partly a psychological issue, which is often related to the intensive care environment and the lack of quality of life in intensive care. What are your thoughts? And what would you like to see in intensive home care nursing services doing for your patients and for your hospital? You can leave your comments below. Thank you for tuning into this week's blog. And if you are a health professional in intensive care and you think you know a long-term ventilated adult or child with tracheostomy and their family who would like to improve their quality of life or their quality of end of life in their own home rather than in intensive care, even if it's to go home for a few days, and if your organization would also like to save money and resources along the way, or if you simply have any questions, give us a call on 03 9939 7456 or just simply send me an email. Thank you.